My name is Terry Taylor. I am from Michigan State University, and for the past 30 years, I've been in Michigan between July and December teaching medical students. And then from January to June, I live in Malawi, and we've been working to understand more about the pathogenesis of cerebral malaria. It just so happens that the rainy season in Malawi more or less coincides with winter in Michigan, but that's just lucky. While I'm in Malawi, I share our house with Michigan State University medical students on elective. So 3 groups of 8 students and I share this house. Each group of students is there for 6 weeks, and this arrangement baffles my peers in Malawi. But I really enjoy the energy and enthusiasm and joie de vivre of these students. And we all are about to experience that again with lightning round number 2. I think the derivation of the term came from clinical medicine when the attending physician was interested in moving briskly through all the patients. That's where lightning rounds came from. We are about to challenge a dogma about lightning, because lightning is going to strike for the 2nd time in the same place right here now. Our first speaker is Farhana Sultana. Each speaker will have 2 minutes. They will trade places during the applause. So, Farhana, over to you.
Oh, shall I?
Whichever.
Okay. Good afternoon, all. So I believe every woman is not born with equal opportunity. However, if they are given a chance, they can do better for others. I am Farhana Sultana from Bangladesh, and I was born in a Muslim family. My father chose to educate me and promoted gender equality in the family. I have studied in anthropology and worked with JICA, the World Bank, and currently I'm working as research investigator at ICDDRB and a senior teaching fellow at James P. Grant School of Public Health at Brack University in Bangladesh. I have worked on issues related to maternal health, newborn health, violence against women, gender, water and sanitation, and women empowerment. I thank Australia Award Scholarship to fund my global health studies at the University of Melbourne, where I have learned about the methods, tools, and theories of global health. I thank Melinda Gates to put together a grand challenges call on putting women and girls at the center of development, as part of which Gates Foundation has been funded female principal investigators to work for the health and development of girls and women across the world. And I am one of the grantees to develop menstrual hygiene management interventions for schoolgirls to keep them stay in the schools during menstruation. And it was not possible without including men, boys, and male teachers. And honestly, I have a couple of men in my life who help my development and leadership skills, and without whom I believe it's not possible to achieve gender parity. And they are my father, my maternal uncle, my brothers, my husband, and Stephen P. Luby, who is the professor of medicine at Stanford University and an incredible mentor throughout my journey of a professional career. So I believe that global health funders, employers, institutions, and leaders can create supportive and dignified environment for women to achieve gender parity through the provision of maternity leave, secure jobs, and all these stuffs. And to finish with, I would like to call for the formation of country-based women leaders forums to mentor millions of the women leaders like us here today so that we can achieve gender parity. And also, if we can promote and video the successful women leaders here or all over the world so that we can encourage other women, potential women leaders, to work in global health. Thank you.
Thank you. Our next speaker is Kyeng Mercy Tetuh from Cameroon.
Hello, everybody. I always give thanks to God for giving me this opportunity. 2 in every 3 women die of non-communicable diseases in Cameroon and other sub-Saharan African countries, yet everybody's silent about it. Watching a teenage mother during one of our outreach programs being diagnosed of cervical cancer was a nightmare no one would ever wish for. In Cameroon, this is the reality we live with on the ground. Our culture even pushes us to become more vulnerable as women take the submissive role and cannot even influence a smoke-free space. Talk less of determining the diet plans in their own homes. This burden is expected to increase by over 5-fold on women by 2035, given that most women get to know about their status only at late stages, requiring very expensive medical procedures, most of whom can't even afford. In a way to bring solution to this problem, I founded Value Health Africa, a non-profit working to reduce on the burden of non-communicable diseases and fostering sexual and reproductive health. Through this initiative, we've been able to reach out to over 2 million community inhabitants with our mobile health awareness programs. We've instituted 9 community checkpoints, bringing diagnosis to the doorsteps of women. We've also instituted on the ground 3 control clinics where positive cases identified during our programs are currently receiving treatment and education. We can't be indifferent anymore. It's time for women leaders in global health to let the world know that NCDs are killing more of our kind. We can do a lot. We can break the status quo. We can change a lot of things. We can all stand up and let the world know that we are there for change. We can do this by empowering many more women to get to know about this week's factors. We can also empower many more women, like one standing here, so they could be agents of change in their respective communities. Yes, we can.
Awesome. Chelsea Takamine.
Thank you very much. So in Southeast Kenya, some people hold the belief that disabilities are caused by witchcraft or sin. And this stigma can lead to dangerous treatments from traditional healers, as well as discrimination, neglect, and violence against children and their families, especially girls and women. After losing a colleague because of these practices, Cynthia and Leonard founded a nonprofit organization called Kupenda to help improve the quality of life for children with disabilities in their community. They are one of 480 teams that participated in OpenIDEO's Disability and Inclusion Challenge earlier this year. Thousands of people around the world mobilized to think about how to increase opportunity and decrease stigma for people with disabilities globally, especially for the 720 million girls and women with a disability that often experience multiple layers of discrimination. So in their work, they prototyped workshops with the traditional healers and learned that there was a reluctance to participate because the healers feared losing their income from referring the children to modern healthcare rather than their traditional services. And so hearing this feedback, Cynthia and Leonard, they thought about it and they mapped out the journey of that experience for the traditional healer and really understood the challenges and constraints that they operated under in their work. Human-centered design allows us to put the people that we're designing for at the center of our work and design alongside them and with them. And Cynthia and Leonard did just that. They refined their approach after hearing insights and started to think about how to prototype including alternative income generating mechanisms into their work. Overall, they're working on an incredibly complex problem while also addressing the larger systemic and cultural context that it's embedded within. While this is just one example, every day we see the impact that human-centered design can have on big, complex challenges, including considering how to advance gender inclusion in global health work. Thank you.
Thank you. And next, Siphiwe Thwala from Swaziland.
Wow. Good afternoon. I come from Swaziland, but work at the Center for Health Policy at the University of Witwatersrand in Johannesburg as a researcher and a project manager. So what can we do to take this agenda forward? The first thing I think is we really have to be serious about equal opportunities. Girls are really smart. I don't need much help. I just need an opportunity, and we can nail it. We need equal opportunities as to that of men in training and in leadership opportunities. If we do not expose girls as they grow up, then suddenly you have somebody stunted when they are older, and it will be much harder to catch up. I also think we need to include men. I was very glad to see the panel here. We do need to include men from in this conversation, right from boys. What's happening now is boys are being let to run wild while we focus on the girls' initiative. So suddenly they are 30 years old and they are being brought to the table, and the whole thing is alien. And unfortunately, girls cannot exist in a vacuum world. We need both parties to come to play. There's a lot I could say, but there's something that came to my heart this morning as I saw this incredible panel and all of the talks that we heard here, and I'd really like to request and challenge our leadership here. Thank you for this great workshop to really think about taking this to the regions. Like for some of us in Africa, I think we've got great potential in young women as leaders, but we often lack support and we need somewhere to reach out to. So a conference like this one is great, it's beautiful, but if it's once a year and every 3 years, whenever I can, it won't have as much an impact as when we could have leadership hubs that we can reach out to when we are being bullied, when we are fighting corruption, when we are fighting lack of opportunities and you need help, you need somebody to reach out to. And often, great as you are often inaccessible. So maybe please do consider that. Thank you very much.
Our next speaker is Ritgak Tilley-Gyado from Nigeria.
Thank you. Good afternoon, everyone. I'm Ritgak Tilley-Gyado. Over the last 2 years, I've worked as an advisor at the Ministry of Health in Nigeria. One thing struck me one day sitting in the conference room in the Ministry of Health, which was looking at the wall of fame of ministers of health in the last 6 decades, and there was only one woman. As I also started my new role, I sought out other people who had been advisors, looking for support, sort of how do I balance the home tensions with the career. And again, I only found one woman, a contemporary, who had been advisor to that female minister. And so in the last 2 years, I've taken away, I think, 3 key nuggets for myself in developing leadership. One is around character. And I was fortunate to undertake a fellowship at Chatham House, directed by Anne-Marie Kimball, which helped me to develop not only my technical competence in my areas, which are primary healthcare and private sector engagement, but also to develop leadership skills, the softer things, negotiation, emotional intelligence, and just resilience that we spoke about earlier this morning. The second is around champions, being one and identifying others. So I started to work with the Department of Family Health in the ministry to push, writing on the Lancet breastfeeding series, to push for increases in maternity leave. And I declare full conflict of interest here. I'm still reproductively active. So I would not want to go back to work 3 months after we've had limited, but made some progress. 2 out of 36 states have increased maternity leave to 6 months. The third thing is around connections. The third thing is around connections, and I realized we need friends in the Ministry of Finance, Budget and Planning, and so on. And I was able to identify other female advisors within those ministries, and we've agreed amongst ourselves to proactively and deliberately support each other's work and facilitate each other's work. So there's so much inspiration in this room. I joined Siphiwe to say I hope we can package some of this and bring it back home with us. Thank you.
Our next speaker is Lisa Ramon. Lisa.
Hi, everyone, and thank you for the 2 minutes. I'm really nervous to be here, but also very proud. I work with an organization called Pro Mujer. It's an organization that was started by 2 women and is focused on serving women. Today, we serve over 250,000 women across Latin America. And the 2 women who started this organization were down in Bolivia and seeing women who lived in poverty and were unable to come out of the cycle of poverty. And they saw really 3 things that these women needed. They needed financial security, they needed empowerment, and they also needed to be healthy. And so they started providing services with a community banking model, which, from a health perspective, I get really excited about, because it means that we've got women to come to our 117 centers every 15 to 30 days, which is a great way to also treat them with preventative services and give them health education and talk about health promotion. Now, why do we work with women, and why do we think it's so important? Especially with the financial security part, there's a lot of research that shows that investing in a woman has a ripple effect, not only in their families, but in their communities, and also in their countries. Research shows that women's income, 90% of it is reinvested into their families, compared to 40%. And what we want to make sure is that women can continue working. I think several people on the stage have said it today. Women are the first ones who don't go to their physicians and don't focus on their health prevention. So that's how we focused on that. Just in this past year, we've helped detect 1,000 potential cervical cancers, 400 potential breast cancers, over 4,000 women with high blood sugar, and over 6,000 women with high blood pressure. Most of these women didn't know that. They continue going to their own jobs. Most of them are self-employed, and they're the primary bread givers of their families. So how do we get these women to continue to be healthy? Now, we also know that we're just scratching the surface right now, and there's a lot more that we want to do. We know that in Latin America, data says it's 40% of women who are victims of gender-based violence at some point in their life. I wonder about that number. I believe it's probably more. And so what do we do with gender-based violence? How do we help women manage their disease? And how do we build the data to help us support this going forward? Thank you.
Next, Anita Raj.
I think you know why. My name is Anita Raj. I'm a professor of medicine and global public health. I'm the founding director of the Center on Gender Equity in Health, and as of last month, I am the Tata Chancellor Professor of Medicine, the first, for my work in global health. So thank you. I'm very proud of that. About 20 years ago, I started my career, and I started my career, as many do, as a newly married individual thinking about family. I started as an academic, pregnant, not negotiating my salary, as too many of us do, and being paid less than the person hired at the same time. I also looked around me and looked at the other women in faculty positions at my institution and saw women who were either without children or who were no longer married to the person they had children with. I was scared. So I started my career, as I said, about 20 years ago as a faculty member, a little bit less than 20 years ago. But I've only been in global health for about 10 years, and although I had opportunity to engage in global health, my fears with regard to family responsibilities impeded my participation. And as I progressed in my career, I watched as my male colleagues and counterparts who were participating in global health, their career advanced with international reputation, where mine did not in the same way. When at the same time, I was given a great deal of social reinforcement for my choice to remain domestically focused and, quote, prioritize my children. Only after working in global health and advancing in academia did I realize that my choice was unfair, uninformed, and unnecessary, and I did not want it to happen to anybody else. Thank you. Thank you. I should say at the same time, one of the individuals advancing past me was my husband then, and I watched as his career progressed. But I have to say I also watched as when our newborn was hospitalized and he called and said he would be late as an assistant professor. They asked him what time would he be there. So it was certainly something I didn't want to see repeat in that regard as well. When creating the UC San Diego Center on Gender Equity and Health, I worked to establish as a core tenet the development of a supportive workplace environment where to advance one's career, you did not have to compromise family or relationships, and that needs to hold true for faculty, fellow, students, and staff. Thank you. And regardless of gender. Via a participatory process, we have been working to develop approaches to address identified concerns. Some of these issues are: we support people to participate in meetings without travel. We create an environment of work support and coverage by redundancies on teams so people can cover for each other. We allow for flexible and part-time schedules, and we work to set and update time protections for partners and family. And we never apologize when you hear our children in the background. Thank you. We have not solved all issues, but we are working hard. Hi, my name's Anita Raj. I have a 14-year-old and a 17-year-old, and next month I will have my 20th wedding anniversary. Thank you.
And our last speaker is Edith Elliot.
Thank you. Ooh. So when I was 13, my mom was diagnosed with a brain tumor. And after her surgery, I was her caregiver. I helped her relearn how to walk, how to talk, how to feed herself. And in our case, we had the means to travel to one of the best hospitals in the world, received the most sophisticated care available. But even then, the only thing I remember from that time in my life was feeling helpless and scared and overwhelmed. And I think this is because as a community, we've focused on building bigger and better hospitals. We've focused on developing technologies that are sophisticated, and we've been thinking about how to effectively and efficiently treat. But that's not where healthcare ends. Sometimes, I think, too often, we've forgotten how to truly care. So about 15 years after my mom's surgery, I was a graduate student here at Stanford. I'm seeing some of the faces, the professors that I knew at the time in the room. And I traveled to India with a course here. And I found myself in a hospital. And what I saw won't surprise you. It was a very hectic environment. It was overburdened. The doctors and nurses simply didn't have the time that they needed to provide the quality of care that in their hearts they really wanted to. But when you took a step back and you really looked at the sea of faces, what you saw was family. Families who truly deeply cared about their loved ones. But in the end of their hospital journey, they were sent home with a bag of pills and a piece of paper that they typically couldn't read, and they were expected to be the care providers for their loved ones, typically women. And so my colleagues and I thought, what if we took a step back? Instead of pushing this highly motivated, compassionate resource out of the system, what if we formally brought them in? What if there was a way to turn hospital hallways and waiting rooms into classrooms? What if we could bring people from the outside in a formal way? So I'm the co-founder and CEO of Nora Health, and we develop systems to help hospitals do this, typically government hospitals, but we do also work in private hospitals. To date, we've trained over 130,000 families. We're on track to train 1 million people by the end of 2019. Thank you. It's nothing. In the grand scheme of things, it's absolutely nothing, and this is where we get a little depressed, because we're not going to be able to make this the standard of care. We're seeing incredible clinical outcomes. We've seen a 71% reduction in post-surgical complications for cardiothoracic surgery. I'm out of time, but we have a list of incredible clinical outcomes that we've been able to measure in newborn and maternal care and in surgery. And now our job is to promote this as a system of care all around the world. So please come talk to me if you want to learn about how you can implement this in your health system, because in the end, we are all caregivers. Thank you.
Thank you all for your attention, and please join me one more time in thanking the fabulous speakers.